Many people believe that if their stress test is normal, they have no heart disease and their arteries are clear. But in reality, that is far from the truth. Stress tests are designed to show advanced blockage, not early plaque. I'm Dr. Mona Shah, triple board certified preventive cardiologist. I'm passionate about early detection, whole heart care, and longevity. In my previous video, we talked about how heart disease rarely starts with symptoms. Today, we're going to dive into stress tests, what they're good for, what kind of stress tests are out there, and does it actually detect disease and early plaque. We've been using stress tests for so many years. Honestly, that was one of the first early ways that we could even detect heart disease. We relied on stress tests heavily. But in modern heart care, there are so many further tests that have come along. But today, we're going to talk about stress tests. What is a stress test? A stress test is when you get hooked up to an EKG. Oftentimes you walk on a treadmill, your blood pressure is measured, your heart rate's measured, and your EKG response to exercise is measured. That's considered a treadmill stress test. What are we looking for? We're looking for EKG changes that are happening when you're exercising. Why would an EKG change when you're exercising? Most often, it will change because you have a severe advanced blockage, 60%, 70%, or more. You will traditionally not see your EKG change on that stress test if you have 50% blockage or less. And let's remember, 50% of people who have a heart attack, their first sign or symptom of heart disease was that heart attack. 60 to 80% of people who have a heart attack, their blockage was under 50% when they had that heart attack. Meaning that you might not have your EKG change during a stress test and you could still have heart disease. But does that mean that stress tests are useless? Of course not. We oftentimes use stress tests for monitoring someone's blood pressure response to exercise. If someone's actually having chest pain when they're exercising, or shortness of breath, or some sort of heart symptom, and we need to clarify, is this a severe blockage that we need to go in and do a catheterization and do a stent or possibly bypass? It's very useful for that. Oftentimes, one can have a heart rhythm abnormality that's only brought out by exercise. And this is a great way of looking at that. And also functional capacity. How far can we actually push you for exercise? And we can monitor you safely on a stress test and see how far that goes. There's also different types of stress tests. The one I just mentioned is just a simple treadmill stress test. But oftentimes we can add nuclear imaging to that stress test, or an echocardiogram to that stress test. And what that entails is you take pictures of your heart first, whether it's with a sonogram of your heart or nuclear images. Then you get stressed with getting on the treadmill. Oftentimes when people can't walk on the treadmill, they have what's called a chemical stress test, which kind of imitates stress on your heart arteries. And then you have repeat images of the nuclear or of the sonogram. And doctors and cardiologists, what we'll do is we'll often compare the rest images and then the stress images. And we'll see if there's a difference between the two images. Like, is there a supply and demand issue here? And if that stress test is abnormal, like there's a difference in that stress images, then we often think there could be a severe blockage going on causing that. Again, 60, 70, 80% or more. So that's where stress tests are really helpful. But let's talk about what I'm really passionate about is early detection. Stress tests will not, and I'll say this again, stress tests will not detect heart disease early. It's not designed for that. It was never meant to do that. There are other ways and other tests that can detect heart disease early. And that's what we're focused on when we're talking about early prevention and early detection. What's happening inside the heart arteries? Let's look at our diagram. When we have a heart attack, we're all the way on this side of the spectrum. This is what we're trying to avoid. We're trying to avoid that severe blockage that then ruptures like a volcano and causes that massive 100% occlusion or blockage in our heart arteries. And oftentimes people think, well, you know, I passed a stress test, I'm fine. But again, that only shows when you get to 60, 80% or more. It doesn't show if you've got a 20, 30% blockage. And those 20, 30% blockage, 2/3 of the time when you're here, that can actually cause a heart attack. How does that even happen? All of this is caused by inflammation, cholesterol plaque, white blood cells, clotting. There's so many things that go into what causes a blockage. And a lot of times when we have 20, 30, 40, 50% blockage, in fact, most of the time, we're not going to have any symptoms. We're going to have no idea that we're running around with this. And we're going to pass a stress test, because remember, stress tests are only going to show if you've got 60, 70, 80% or blockage or more. It's not going to show if you've got anything under 50%. But if that plaque ruptures, if you go from a 20 or 30% blockage and that plaque explodes like a volcano, in a second, it goes to 100%. Those are the stories you've heard. Well, my friend was working out, my family member exercises, they even just ran a marathon, they passed a stress test, and then they had a heart attack. Doctor, how did that happen? I don't want that to happen to me. That's probably one of the most common questions I get. I don't want that to happen to me. How do I make sure that my arteries are okay? So again, stress tests are great for when it's the right time and place and symptoms for it, and depends on what we're looking for. So I don't want to say that stress tests aren't important still in cardiology, but if we're really looking for early detection, stress tests aren't going to be where we put all our eggs in that basket. And in future videos, I'm really going to dive deep into what scans are important. There's a lot of more modern scans out there now that we can actually detect heart disease early. There's biomarkers, there's labs that are really important. Once we figure out if we do have heart disease, okay, now what's going on under the surface besides just an LDL? And we want to look at insulin resistance, we want to look at inflammation, we want to then put all of that together and really dive into our diet, our lifestyle, our exercise, supplements, medications when necessary, so we can prevent that heart attack and prevent the long-term consequences of having heart disease. It's all about early detection and prevention. We don't know until we know, unfortunately. And we want to avoid being that 50% that our first sign of even knowing that we have heart disease was that heart attack. It's not about fear, it's not about being scared, it's about really knowing our bodies and knowing what we can do so we have a healthy life and quality of life that we want to have. If you're interested in more conversations like this about longevity, prevention, and early detection, please tune in for more. My next video, I'm going to talk about what some of those scans are and when it's important to get them.